What about a behavioral slash quality of life assessment? How important is this?
Well, most people in the health and fitness field don't consider themselves to be psychologists, and that's true. But they themselves are on the front lines in terms of a person's behavioral aspect. And in a previous video, I spoke about the fact that there are a percentage of people who take GLP-1 medications who are having behavioral issues. So I'm actually going to read a little bit from my GLP-1 manual and talk about some of these assessment issues, which are actually classified in the DSM-5, or the Diagnostic Manual of Mental Disorders, that the American Psychological Association uses. And trainers need to have just a rudimentary knowledge of these things. And of course, they're already familiar with things like excessive worry and excessive anxiety, problems controlling that anxiety, other medical conditions that may be causing these symptoms, which are actually causing some of the anxiety, restlessness or feeling on edge, becoming tired or fatigued easier than normal, problems concentrating and feeling like your mind is going blank on a regular basis, being irritable, having muscle tension or muscle aches that are sort of unrelated to the exercise, and problems with sleep. These are some of the major behavioral issues that trainers need to sort of recognize and say, well, what kind of exercise program can we have that may address these? In the manual, I make the comparison a little bit between a person who's on a GLP medication and a cancer patient. Cancer patients who are having chemo or radiation therapy sometimes have trouble absorbing nutrients, so they're on special types of supplements as well. But from a behavioral standpoint, cancer patients have done very, very well doing relaxation programs in addition to their exercise. So they train for 30 minutes and then they go into the yoga room or the aerobics room. They lie on a mat and they listen to relaxation music for 20 minutes. These types of programs that work in synergy are very, very good for GLP-1 patients, because what we want to do is avoid some of these behavioral issues that may manifest themselves over a long period of time that can be rectified with exercise, relaxation, stretching therapy, music therapy, even laughter therapy, if they are done within the gym. So those are the types of things that trainers can do to be proactive in terms of behavioral programs without actually having to diagnose anyone with a behavioral problem.
And where can I learn more about behavioral assessment and GLP-1?
Well, I talk about that in the book. I've got a little more information on it. So if you log on to medhealthfit.com and click onto the GLP program, that'll get you moving in that direction.